Hi there, I'm Dr. Andrea Purcell, and you are watching Straight from the Doctor's Desk, where natural medicine is used as the first resort to achieve the health and life that you love. So, welcome back. Today we are talking about fibroids. Fibroids have been the source of heavy bleeding, constant spotting, and even pain in women for decades. And we're going to talk all about that today. So what is a fibroid? It's a benign growth inside the uterus. Some of them will actually grow outside the uterus and hang into the abdominal cavity. They typically grow during the reproductive years and also during perimenopause. However, if you have a fibroid and you're about to enter menopause, that's good news for you because fibroids will shrink in menopause because they respond to estrogen. And as estrogen levels decline, the fibroid loses its food source and will shrink. So fibroids account for the majority of hysterectomies that are performed. And really the conventional medical approach hasn't changed much with these little growths for a long, long time. The conventional approach is really a watch and wait approach, which means that we'll diagnose a fibroid, watch it, see if it grows, and if it grows and continues to grow, then surgery is recommended and performed. So there are three very common surgical procedures to treat fibroids. The first is a hysterectomy, which is uterus removal. The second is something called a myomectomy, where they remove the fibroid that's embedded in the wall of the uterus, so the entire uterus is not removed. And then the third procedure, which has really gained in popularity in the last 5 or 10 years, is called a uterine artery embolization, where they inject these little pellets into the uterine artery to decrease the blood flow in the attempt to cut off circulation to it so that the fibroid will shrink. So fibroid surgery is something that I was introduced to at the young age of 13 because my mother had fibroids. And I remember the day that she came home and had a conversation with me that her doctor had discovered a fibroid and that he was going to watch it and see if it grew. And if it did grow over the next year or two, then she would be scheduled for surgery. So at her first appointment, her fibroid was the size of a lemon. And then she went back 6 months later and it had grown to the size of an orange, or that's how she explained it to me. I mean, I was only 13. And then at her final ultrasound, her fibroid had grown to the size of a grapefruit and her doctor scheduled her for surgery. And this is the classic watch and wait approach that I talked about just a couple of minutes ago, where her doctor was monitoring her for the growth, and then once the fibroid reached a certain size, surgery was scheduled. So my mother planned her surgery for June strategically. She waited until school was out, and she told me that she planned to recover for about 2 or 3 weeks post, because that was a while ago. It was in the 80s, and it was a longer recovery and a different surgical procedure that was done back then. But she told me that I would be in charge of cooking, grocery shopping, and watching after my younger brother. You know, my father worked a lot, he traveled a lot, and he was gone long hours each day. So she coordinated with our neighbor to drive me to the grocery store, and she put aside money each week that I would use to buy groceries, and then I would shop for, I would make a list and shop, and really that was the first time for me that because I took it all so seriously, and it was the first time I thought, like, oh my gosh, what would it be like if my mother wasn't here? And I remember feeling so helpless that there was no way to fix this fibroid and that surgery was the only option. And looking back now, I can still identify with that frustration of not understanding, well, how did the fibroid grow? Why is it there? What's causing it? Because I really had a hard time accepting that there weren't really any answers. The response was, well, nobody knows, but if it continues to grow, then surgery is going to be scheduled. So years later, when I was in medical school, I also discovered that my maternal grandmother had a hysterectomy because of fibroids in the 1960s. And that was, long before I was born, probably a decade or more before I was born. So the point here is that hormone imbalances can be passed along a family line. And it is really important for you to know about the history of your other family members, especially the women in your family, and especially along that maternal line, so that you can reduce the risks in your own life. Because, if history is going to repeat itself, and my grandmother had one and my mom had one, well then, I'm the next in line. So what really can we do to reduce our risks and prevent fibroids from affecting our life, the quality of life, or even setting us up for surgery in the future? And then there are some horrific stories that you will hear about fibroids causing hemorrhaging and anemia and weakness and fainting in women. And I certainly, want to prevent any woman from ever getting to that point. So something that I also hear commonly when a woman sits down in front of me is this. I've lived with fibroids for the last 5 or 10 years of my menstrual cycle, and my periods just got heavier and heavier, and I thought that it was normal. But then a couple of years before I went into menopause, my doctor told me that I had fibroids, but I had just gotten used to living with the heavier cycles. So my point here is that heavy bleeding is not normal. Okay, so it's a sign that something's not quite right. So if you are in your 40s, in your 50s, your bleeding's getting heavier and heavier and heavier, you shouldn't just live with it, because there are thousands of women out there walking around with heavy bleeding or having frequent periods, 2 times a month, and not thinking anything of it. But you could develop anemia, and anemia is not without risk, right? Because if your blood count gets so low, you could become weak and faint and pass out and really endanger yourself. So what's going on with fibroids? What's the scoop here? And I would say that for the most part, alternative practitioners have long suspected the link between estrogen and the environment to fibroid growth. And the really cool thing is that research continues to reinforce this theory that we're all working off of, which is that fibroids grow in an estrogen dominant or a high estrogen type of environment. And hormone disrupting chemicals that are in our environment will mimic estrogen. They're called estrogen mimickers, and they will make the body think that they are estrogen and turn on estrogen receptors and do things that estrogen, the hormone that we naturally make, does in our body. So they contribute as well. So fibroids grow in response to elevated levels of estrogen, and in some smaller instances, they grow in response to progesterone as well. But frequent and heavy bleeding can be a result of elevated estrogen, so we need to look at that. So maybe we need to start with, what causes estrogen levels to rise? And there are really 3 risk factors that cause estrogen levels to rise in women. 1, estrogen is produced by fat cells. So women with a higher BMI or body mass index are at an increased risk of estrogen dominance. 2, during perimenopause, which is that time right before we get into menopause, right before the period stops, so could start as early as 40, 45, the first hormone to decline is progesterone. So what it does is it leaves the body in a high estrogen, low progesterone environment. So that's why fibroids can grow during this perimenopausal period. And then environmental sources of estrogen. We live on planet Earth, and planet Earth is polluted. And we are exposed to a lot of chemicals every day. Some are within our control and some are out of our control. And what I want to do today is share with you the ones that are within your control so you can recognize them and minimize your exposure, thus decreasing your chance of having estrogen mimickers and causing fibroids to grow in your body. So the first chemical that I want to talk about are phthalates. and that's with a pH, even though it sounds like, a T, phthalate. But they're chemicals found in vinyl, soft plastic beverage bottles, plastic storage food containers, which is why you should be using glass, plastic food wrap even, right? So you think about how many things are wrapped in plastic, cosmetics, and anything fragranced. Okay, so anything that is not a natural fragrance, like if it's a cup of peppermint tea and it's coming from the peppermint plant, that's good. If it's peppermint and it's not a peppermint essential oil or a peppermint extract, chances are it's probably fake peppermint. So anything fragranced or fake is going to contain phthalates. So when you realize the negative health implications of all these fragrances that people use and we use throughout society, they quickly lose their appeal. So I'm going to tell you a short story about fragrances. So when I got married, my husband was used to using this highly scented cleaning product that is a staple in many Mexican households, and it's called a Fabuloso. And it's purple, and it smells like fake lavender, and people just go gaga over it. Right? So I pulled up the ingredient list one day, and honestly, it read like a hormone disrupting horror story. And I showed it to my husband, and then I showed him what all of those chemicals did. And he realized that Fabuloso was not so fabulous after all. So sometimes it just takes a little bit of education. So there's phthalates, and then there's BPA, bisphenol A. And this is a chemical that was found in plastic baby bottles, water bottles, the lining of metal food cans, and now you'll see products labeled BPA free. Hooray, they took the BPA out. But guess what? They're using BPA's sister compounds, which have the same chemical structure and are suspected of having the same estrogen mimicking properties as the BPA. So these are now BPB, BPS, BPF, BPAF, etc. So beware of all of these things. So even though something says it's BPA free, hooray, but did we win that battle but really lose the war? So that's why in my son's case, right, he's 3.5 now, I moved out everything plastic as soon as I could, and I moved to stainless steel. So he's got stainless steel cups and mugs and plates and forks and spoons and knives and water bottles, etc. It's really important to get the plastics out, and you never, ever, ever should be microwaving in plastic ever, because that will leach these chemicals then into your food, and then you'll be eating it as well. Okay, and the third group I'm going to talk about today are the chlorinated hydrocarbons. So they're a group of chemicals, especially found in pesticides, but DDT, PCBs all fall into this category. And the biggest exposure is through your diet. So that's why it is really, really important to choose organic and limit your exposure to these pesticides. So I know there's a lot there to talk about, but I want to cover my 5 tips for preventing and stopping the growth of fibroids. All right? All right, so hang in there. I want to go through my 5 tips with you. 1, limit your environmental exposure by drinking from glass or stainless steel. Just do that. Just say, okay, I'm not going to drink out of plastic bottles anymore. I'm not going to microwave in plastic anymore. And then really start to look at where fragrances are within your home, within your body products, your shampoos, your cosmetics, your nail polishes, and see if you could start cutting out some of those fake fragrances and maybe replacing them with something more natural, like with essential oils or something else that's a cleaner product. Okay. 2, if you have fibroids or family history of fibroids, it's probably a good idea to start working with an alternative practitioner to measure your hormone levels and get you on a plan to make sure that your hormones are properly balanced so you don't end up in an estrogen dominant situation like we talked about. Number 3, consider a liver detox. So a good detox is somewhere between 3 and 4 weeks long, and it will help your liver clean out, and because your liver is responsible for breaking down and metabolizing your hormones, including the estrogen. So we want to make sure that your liver is doing a really good job of that. Number 4, eat a diet high in fruits and vegetables. If you've watched some of my other posts before, you know I'm a big fan of 5 to Thrive, 5 servings of fruits and vegetables each day. And I got a little jingle, you know, eating 5 to thrive. It's a way to get living. So even if that little goofball rhyme sticks in your head, it's worth it because 5 to Thrive is where it's at. Okay, and then number 5 is organic is best, because if you choose organic fruits and vegetables, then you will be decreasing your exposure to those chlorinated hydrocarbons I talked about, and those are estrogen mimickers. Dang! And the other thing I want to tell you about that is that those chlorinated hydrocarbons have been measured in the fat and the blood samples of women with fibroids. So we know that women with fibroids have higher levels of those things. So by choosing organic, you get to reduce your exposure to them. And that is a good thing. So that sums up today's conversation on fibroids. And like I always say, you become who you hang around. So let's hang out some more, and we'll help change medicine one person at a time. If you feel inspired to share, please do so in the comments below. And if natural medicine speaks to you, you can learn a whole lot more on the web at drandreapurcell.com. Bye for now.